Hello, my name is Victoria Kline and I'm reporting from the Canadian Rheumatology Association annual scientific meeting here in Ottawa. And I have Dr. Cheryl Barnabe here with us today. And just on behalf of the Arthritis Broadcast Network, we'd like to thank you for being with us. And if you wouldn't mind sharing a little bit about you and what you do.
Sure. So I'm both a rheumatologist and a researcher at the University of Calgary, and I work within the departments of medicine and community health sciences. My research interests are in epidemiology and outcomes research for rheumatoid arthritis, and particularly in the First Nations or Aboriginal populations of Canada.
Since arthritis appears to be primarily a women's disease, what special needs or concerns do your female patients with arthritis have?
So when the patients are first presenting and have different symptoms from the arthritis, they are having difficulties with doing their normal roles in society. So they're not able to keep up with the work that they're doing, or perhaps they can't fulfill their roles as mothers or child caregivers. And what we see is that they really need to return rapidly to their level of functioning that they had before they had arthritis. And so in my practice, we're also trying to manage medications and disease activity around the timing of pregnancy as well. We want to try and optimize both the mother's outcomes as well as the baby's outcomes and make sure that people are fulfilling every role that they would like to be fulfilling.
How can healthcare access be improved?
So I think part of the problem is related to the ability to provide culturally safe care for patients with arthritis when they come from Aboriginal communities. So we know that in the healthcare system, those initial contacts are critical to developing trust, as well as to developing a rapport with the physician or the healthcare providers. And if we can develop that rapport and trust, then we have people who are wanting to come back for care, and that allows us to achieve our treatment targets in a better way, or in a more a better outcome way. We would also like to make sure that people have equitable access to therapies and to therapeutics, and not just to drugs, but also to things like allied health professionals, adaptive aids for arthritis. So we certainly have a lot to improve on the current mechanisms of access.
Thank you. Lastly, what do you think can be done to eliminate and reduce the risk of rheumatoid arthritis amongst the Aboriginal population?
So we know that we don't really know exactly what the cause of rheumatoid arthritis is yet, and so it's hard to pinpoint how we can prevent it or reduce risk. But we do know that part of the risk is related to the environment that people are being living in. We also know that part of the risk is related to some of the social determinants of health. And so we need to address all of these and improve health outcomes more broadly, and that will have a positive impact on rheumatoid arthritis as well. So if we think that rheumatoid arthritis could be triggered in part by oral bacteria and access to dental care is difficult, then by improving some of the other social determinants of health, we may actually improve that risk in that way.